Hello, today we're going to talk about air travel using a manual wheelchair. As a disclaimer, please take a moment to read this and pause if you need more time. The key takeaway from this video is that you'll be able to know the recommendations of how to safely and efficiently participate in air travel using a wheelchair. Some considerations when booking your tickets would be to consider a nonstop flight if possible. I always recommend a domestic nonstop flight. Hopefully a little bit of a shorter flight is ideal for a first flight. Try booking a flight earlier in the day is also recommended in case there are any issues that arise. There's more time once you reach your destination to get those things sorted out. An aisle seat is preferred when possible. We'll talk about how you're going to be getting on and off of the aircraft. And so an aisle seat will make for ease of transfer. And then just being mindful of weather issues that might impact your air travel. If you're traveling during the winter through Chicago, being aware that, if a storm comes through, you might land there and have to spend a little extra time. So just packing appropriately so that you have things in case your travel plans last longer than anticipated. Planning ahead is huge, so arrive to the airport 1 hour prior to your normal check-in time. If you have a domestic flight, typically you'd get there 1 hour ahead. We would recommend getting there 2 hours ahead to allow that additional time, specifically getting through security or checking luggage might take a little bit of extra time. And then determine how you're planning to get to and from the airport. At Salt Lake International, we have the TRAX line that can take you there. You can consider a ride share, an accessible taxi, having a family or friend drop you off. If you are parking there, if you have an accessible parking placard, you can park at the short-term parking lot at the long-term parking rate. And that does apply at the Salt Lake Airport, but you'd want to check at your own airport for details and pricing on that. When it comes to luggage, curbside drop-off is an option. Airlines are required to assist with carry-on luggage if you're unable to transport it yourself. There are different ways to hook the luggage to your chair or place it on your lap, depending on how heavy it is and the size and your balance and different factors. And then it is free to check luggage related to your medical equipment and needs. So if you need to bring equipment for, say, the bathroom where you're traveling, or if you're bringing catheter-related supplies for your bladder, all of that luggage should be checked for free. When you go through security, you should expect to be screened by TSA. You would stay in your chair. Once you go through security, you will be patted down. The TSA Cares program exists specifically to assist people with going through security, especially those who have physical needs that they might need assistance with. So consider calling them for more information or looking them up online. You are able to carry extra baggage if it is related to medical equipment or medications, and you're exempt from that 3.4 ounce rule. So there's things to keep in mind as you go through security. When loading your chair, it's important to know that you can stay in your personal chair until you get to the gate. At the gate, you can choose if you're wanting to transfer into the aisle transfer chair, which I'll show you a picture of in just a moment. At the top of the jet bridge, at the bottom of the jet bridge, you'll be one of the first people to load the plane. You may ask to speak directly to the pilot or to the crew members that will be loading your chair to specifically tell them how to handle your chair. We highly encourage that you take a before picture of your chair in case there is any damage. If something gets bent or ripped, anything is broken, this way you have evidence that the chair did not look like that prior to the flight, and so they are responsible for fixing it. Removing anything that can be removed will just decrease the risk of having anything happen underneath the plane to your chair. If you have laterals or armrests, your cushion, anything you can take that off and bring that on the plane with you. And then consider labeling your chair with your contact information and flight details to ensure that it reaches your destination. When transferring to your seat, I mentioned that you'd be getting into an aisle transfer chair. That is that black chair right there. Typically, it's pretty low to the ground. And so depending on how you move and transfer, it's usually a downhill transfer, which tends to be easier. Getting in isn't as hard as then getting out of that chair can sometimes be. It's very narrow, and those straps are meant to help with balance. It's very important that if you're needing assistance with getting in and out of that chair, that you're very direct with how to advocate for your needs and how someone needs to help you if you're not traveling with somebody who is going to help you, or if you're not independent with that transfer yourself. In the picture where you can see the gentleman moving to the chair using more of a lift system, and that's called an Eagle system, and that is becoming more common in other countries. It is not as common in the United States yet, but you can imagine that for somebody who has limited mobility, that this is a nice option for being able to get in and out of the seat a little bit safer. What to carry on the plane. So medication-wise, it's important to have anything that you're going to need medication related if you have a delay or if you need some medication on the plane. A change of clothes is always a good idea. We don't want to plan on incontinence happening, but in case it does, it's a good idea to have those clothes. Cathing supplies, if you're using catheters to empty your bladder, you'd want to make sure you have access to that. Consider wearing compression stockings, even if you don't usually use them in your daily life. And a wheelchair bag can be really helpful for removing those removable wheelchair parts. You can use whatever bag you'd like to bring with you. A simple car seat or stroller style bag can be an inexpensive option for all those wheelchair parts. Consider your skin when flying. So just as you would in your chair, you're going to be completing pressure reliefs. And so when flying, it's no different as to the fact that your skin is going to need you to shift your weight to keep that tissue in your skin healthy and get the circulation to especially those bony areas. And so you can use your cushion, your typical wheelchair cushion on your seat, but you do want to consider your positioning. Here at NRH, we do have airplane seats where you can practice and kind of see how you position in the seat with and without a cushion. There has been some research to show that this purple cushion, this 2-inch cushion, can be really helpful with pressure relieving during air travel. And just being mindful, if you do have an air cushion, how air pressure changes during air travel. So that will affect how the cushion is working as well. When it comes to pressure relieving during the flight, that might look like leaning laterally, so side to side, or leaning forward, making sure that's safe and coming back up. And then depending on arm strength, pressing up, but just making sure that weight is being shifted throughout the flight. So if you're using catheters to empty your bladder, it's important not to dehydrate yourself to avoid catheterizing on the plane. We would recommend emptying your bladder right before getting on the flight if possible, if you are using catheters to empty your bladder. But if you do need to empty your bladder while flying, you can use a blanket as a cover for a little bit more privacy, since you won't be able to access the restroom while flying. There are closed system catheters that have a bag attached to them. There are also gel urine bags that can make liquid into gel if you have an open catheter style. In some cases, people will choose to have an indwelling catheter placed for longer air travel, such as a Foley. As a reminder from our bladder education, a Foley does have a higher risk of a urinary tract infection. Definitely consult your doctor before making any decisions regarding your bladder management with flying. The take-home message is that it's important to plan ahead. It's going to take a little bit of practice, but always consider your safety first before returning to air travel. Discuss with the doctor if you're planning to fly and make sure you have medical clearance. And then just know that hopefully it'll get easier with practice. And there are many accommodations in place to make air travel safe and successful. However, improvements are still needed. There are definitely things that are lacking. One of the biggest issues is being able to access the restroom while on the plane. There are other factors such as keeping wheelchairs from getting damaged. And so there's many campaigns and things happening. The new Salt Lake City Airport has many accessible options, but it is quite large, so do allow extra time, as it can be quite a distance that you have to go depending on where your gate is. Please let us know what questions you have related to air travel, and we're happy to assist with providing additional resources and answering questions. Thank you. Have a great day.